Hi, I'm Colleen Hutchinson. We are at the 18th Annual Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. I'm here today with Samer Mattar, who currently serves as ASMBS President. Samer, thank you for being here.
I'm happy to be here.
Can you tell us a little bit about yourself?
Sure. I'm a bariatric surgeon. I'm currently practicing at Swedish Medical Center in Seattle, Washington. I've been doing bariatrics ever since I finished my training. It's been 18 years now. My practice is 100% bariatrics. And I think I have the most rewarding and satisfying job in the world.
As ASMBS President, what are the long-term goals and priorities that you've been working on and will continue to work on?
There are some important projects that we need to address. Some of them will be hopefully come to fruition earlier, and others are more long-term in nature. For example, we really do have to address the fact that many of our patients don't follow up, and the follow-up rate doesn't seem to be as optimal as possible. We seem to have a large amount of a lack of retention after the second, third, and certainly by the fifth year. And so we're working hard to find ways of retaining these patients and making sure that they stay engaged with the programs. And this is not only to improve our outcomes, but also to help support them. As you know, weight regain is always a potential complication, and we try to avoid that through continuous support of our patients. And in order for them to receive that, they have to stay engaged. So we're looking at ways of lifting the burden from patients from having to take a day off to come and see us. For example, using new technologies such as remote medicine, telemedicine, the internet, biometric scales, anything that will allow us to stay in touch and connected to the patients. So that's one main project. The other is, is how to better protect our patients from deep vein thrombosis, whether it's peripherally in the legs or more lethally, those that can become pulmonary embolus. And although the safety of bariatric surgery has reached unprecedented levels, the main cause of death still remains pulmonary embolism, PE. And the reason why we haven't been able to standardize prophylaxis against this is that our patients come with many different medical backgrounds, different sizes, ideal body weights, and so on. So we're working hard to come up with a formula, some kind of policy that can be standardized and used for all patients. That is obviously both cost-effective and easy for the patients to adopt and maintain, and hopefully that way will reduce the incidence of death even more. We do have other projects also, as you know, with regards to the annual meeting. We've decided to link the meeting with a particular topic every year to bring in some of our colleagues from other specialties, and also to highlight the multidisciplinary nature of our profession and how we collaborate with cardiologists, with hepatologists, with orthopedic surgeons. So every year from now on, the annual meeting is going to be linked to a theme. So our upcoming meeting in November is going to be linked to the heart. And we have Steve Nissen, who's kindly agreed to be our keynote speaker. As you know, he is a world-renowned cardiologist at the Cleveland Clinic. And the year after that, when Eric DeMaria is going to be president, his meeting, the theme of that will be cancer. And as you may be aware, we've made a lot of progress in understanding the underlying biochemical and biologic mechanisms of metabolic surgery and how it impacts cancer. And by that time, we're expecting a lot of new data to emerge that will help. And so these are some of the changes that we're making.